Hello, and welcome to the Hawai'i Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John, the Public Health Epidemiologist with the Hawai'i Health Data Warehouse, or HHDW, and we're going to use the next 30 minutes to introduce you to the social determinants of health information, including the SocioNeeds Index, the Food Insecurity Index, the Socioeconomic Status Tracker, and a few other resources in Hawai'i Health Matters. So what are the social determinants of health? The social determinants of health are the conditions and in the environment where people are born, live, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes. Healthy People 2030 uses a place-based framework that outlines the 5 key areas of the social determinants. Economic stability is the connection between the financial resources that people have, so their income and the cost of living and the socioeconomic status, and their health. And it includes issues such as poverty, employment, food security, and housing stability. Education access and quality is the connection of education to health and well-being, and it includes key issues from early childhood education and development to language and literacy, to graduation from high school and enrollment in higher education. Healthcare access and quality is the connection between people's access to and understanding of health services and their own health. And it includes issues such as access to health care and primary care, health insurance coverage, and health literacy. Neighborhood and built environment is the connection between where a person lives, their housing and their neighborhood and that environment, and their health and well-being. And it includes topics like housing quality, access to transportation, availability of healthy foods, air and water quality, and neighborhood crime and violence. And then lastly, social and community context encompasses the connection between the characteristics of the context in which people live, learn, work, and play, and their health and well-being. And it includes topics like community cohesion, civic participation, conditions in the workplace, and in incarceration. And while you may be familiar with Hawai'i Health Matters as a great place to explore the proportion of the population that has a particular health condition like asthma or cancer or heart disease, it's also a great place to find information about the social determinants of health that can impact the patterns and distribution of disease. In fact, social determinants of health is one of the organizing principles of HHM and its health and context philosophy. So today I'm going to show you 2 indexes within Hawai'i Health Matters, or HHM, the SocioNeeds Index and the Food Insecurity Index. And we're going to examine the federal poverty and ALICE threshold data. We're going to take a look at the Socioeconomic tracker. And throughout the demo, we're going to review some ways to do keyword searches for social determinants of health information while you're navigating through Hawai'i Health Matters. So let's start with a brief overview of the 2 proprietary indexes that you may have seen within our system. The SocioNeeds Index and the Food Security Index were both created by research teams from our website host, and that's Conduent Healthy Communities Institute. And unlike other population-based data, which often comes from the census, they use Claritas, which is a large, continuously collected database that's used for marketing. And Claritas provides more up-to-date and detailed and granular population data. So they use different indicators from Claritas to create indexes of a variety of social and economic indicators to create composite scores from 0 to 100. So from low need to high need based on their index values. These scores were calculated for different geographies across the nation. So they did it by county, they did it by zip code, and they also did it by census tract. So they each were given a score from 0 to 100 in terms of socioeconomic needs or food insecurity needs, right? And then those were then ranked from 1 to 5, from low to high, according to their index level in each state. So we'll be looking at 2, the SocioNeeds Index, which is a measure of the socioeconomic need that's it's correlated with potentially preventable hospitalizations. And we'll be looking at the Food Insecurity Index, which is a measure of food access that is correlated with economic and household hardship. And we'll get into more detail on both of those during the live demo. Another indicator section that I just wanted to bring to your attention, we'll be looking at today, involves income. And so income is a big factor in many of the social determinants of health. How much money you have at your disposal influences where you live, how long you commute, the kind of food you can buy, the access to healthcare that you have, and even your safety. And while most people are familiar with the federal poverty level data, which is an indicator of extreme need, we also have information on something called asset limited income constrained employed, or ALICE households. And these are households that are above the federal poverty level, but they still are below the level of a basic cost of living. Something that some people used to refer to as the working poor, but it really helps you paint a picture of need in a community that's far beyond the federal poverty level. I'm also going to introduce you to our socioeconomic status tracker, which has been there for a while, but you may not have seen it. And then we're going to review a few strategies for keyword searching in HHM to help you find social determinants of health information. To get to hawaiihealthmatters.org, you can type that directly into the URL into your browser, and I invite you to follow along if you can to do this as we go. Or you can also just always come to hhdw.org and click on the green button or on the link at the top of the page. Once you get to HHM, we're just going to go directly to the Find Data page today. So I'm going to click here, and this brings you to our Explore Data page. We've covered the demographics dashboards and the community dashboards previously. We can see that we have a disparities dashboard, which we'll save for another day. And today we're going to focus on the SocioNeeds Index and the Food Insecurity Index. The navigation for these is similar. So we're going to go over one more thoroughly and then just briefly touch on the other. So the SocioNeeds Index, to remind you, it allows you to identify the zip codes and census tracts that have the highest level of socioeconomic need. So we'll click on here, and we'll get that display that you may be familiar with. It will first show you the, well, in a minute, it will resolve the maps. And then you'll have the data table beneath it, and the chart, and then the data table. All three of these are combined so that as you highlight on one, the information highlights on its corresponding chart and table. So that you can say then, so that's going to be our display. If you're trying to remember, what is this index and how did they get here? We have a how does it work that again tells you how they go in about calculating this, that they use several different composite of indicators and assigned everybody an index value from 0 to 100, with low being good and high being bad for highest value. Then those they put into a group of 5 ranks, which corresponds to your color. And then we also have this Learn More button here, which gives you more in-depth information about this index and where it came from. But it's based on, to remember, is that they took several socio and economic factors ranging from poverty and education that impact health or access to health care. And this index is correlated when those factors they put together are correlated with potentially preventable hospitalizations. And the data source was the Claritas estimates for 2021. So you can see here that you can take a look at our general map feature. If you want to focus in on an area, of course, you just click in on the zoom in. You can zoom out. You can always reset to here. If you really like this map, you can go ahead and you can add, in this case, we're looking at zip codes. You can add the zip codes onto the map and zoom in and whatever. You can go ahead and download the map to export. So if you like it, it's available for you that way. If you want to zoom in and get a little bit more detail, so let's say we're looking at this, I'm just going to get rid of the zip codes to make it a little less cluttered. I can narrow my selection by county. So let's say I'm going to take a quick look at Honolulu County here. So that's going to bring my Honolulu County into focus, and I can go ahead and zoom in on that some. And I can look at my data here by zip code. And I can hover over and see in terms of SocioNeeds Index, the areas with the most socioeconomic needs. You can see here that, you know, Waianae is there at the 81.8, and then down here, you know, you got the, you know, Kahala Coast there at 1.5. Again, you can always scroll down here and it'll give you a little bit more information. If you want the data, you can adjust these graphs a little bit. You can download the data, you can download the map. And this one, I can actually zoom in a little bit deeper. And if I want to look a little bit more in depth, I can look at the data actually all the way by census tract. And then you can see what the census tract level for socioeconomic needs are for Honolulu County. So it just gives you this really great way to sort of dig in to be able to, again, to characterize some possible needs of your population. So then we can just go back, and if I want to go through, I can go through the find data page or come up here and I can look at the food insecurity index. And again, this is going to have very much the same look and feel. You have your how does it work? What did we use to determine this? And again, how these factors were compiled to create these ranks from this index from 0 to 100. Those were done across the country. So if you know that you're in like the top 100, it's not just of Hawaii, of your county or of your zip code, it's of all zip codes across the country. So it really helps you understand in context, where you stand. And then also, again, with our learn more, you can come back and why it is important, how it can be used, and this tool is based on. And again, so they use socioeconomic factors from household expenditures to perceived health status that impact the household's ability to access and purchase food. So this index is correlated with hospitalization and emergency room patients that exhibit characteristics of socioeconomic burden and SNAP eligible participation. And again, they used Claritas estimates for this as well. So just kind of give you where the source of the data is. And again, same sort of look and feel. So this case, I'm going to go ahead and zoom in on Hawaii County. And then I can look at the data by zip code. And then I can go ahead and say, I want to get a little bit deeper and dig by census tract. There's not that many more census tracts in Hawaii County than there are zip codes, so you can't get as deep, but you can definitely go through and say, all right, this is what my census tract looks like in terms of its food needs, its food insecurity index, and in terms of its socioeconomic index. And we have other data within the system that's also available at that census tract level. So you can begin to really overlay and to create a real profile of your area, either at the census tract or the zip code level, to really understand what the issues might be for your community. So now I'm going to just navigate over to our community dashboard. So we have little breadcrumbs. I don't know if I pointed these out before that are always here across the top. So I can come up to find data and hit community dashboard, or I can just navigate right here to community dashboard. And this is our main search function. So I'll show you another place to search in a minute. But for example, we've talked some issues about, we looked at the food insecurity index, and I said, well, what other information are you hiding in here, Tanya, about food? So I'm gonna go ahead and just hit food. And you can see that we have a lot of indicators regarding food. So from food insecurity rates to food environment index, more information about food insecure households, and just a whole bunch of grocery store density, farmers markets, and so forth. So you can see there is quite a bit of information in the system if food is your area of interest, which is really, truly a social determinant of health, right? You have to be able to eat healthy to be able to live well. So I'm going to go back now because we said we would talk about poverty. So I'll go ahead and do the same thing and just hit poverty in here. And I can get a full list of all the indicators that we have that may be related to poverty. And you can see there's a lot. So as in food, we had SNAP. We'll also have SNAP here in poverty because you have income requirements for there. But you can see then we have like children and families and households with below the poverty level, seniors with the poverty level, all people living below poverty level, and those living 100% below poverty level. So that would be the most severely impacted. So there's a bunch of different indicators here, but let's take a look at households that are below the federal poverty level. So you can see that this is an indicator that we have data available at the state, county, census place, and zip code level. So I'll go ahead and click here on state. And you can see then again, this is our standard indicator report. So you see it's for the state of Hawaii. This is our measurement period. This is what we're looking at. This is why it's important. And you can see that in Hawaii, 9% of households are below the federal poverty level. This data comes from United for Alice, and that's that term we were talking about a little bit ago. We can keep scrolling down and we can say, all right, I can look at this information by county, for example, for the state. And I can see that, wow, there's quite a bit of difference in it's 9% overall for the county. But if I look compared to the state value, you've got two that are quite below. Maui, there's not that many families, 5% live below the federal poverty level compared to on the Big Island that it's 16.9%. So there's some definite discrepancies there, disparities, and I can go ahead and I can look at it, dig down even deeper. Scrolling down again, I can remember that I have other indicators that might be related to federal poverty. I also have other reports, and there's the ALICE report, that we're going to get to in a second. So I'm going to focus from here on the households that are asset limited, income constrained, and employed, or ALICE, something that people used to call the working poor. I'm going to go and take a look at this. So these are people with income above, households with income above the federal poverty level, but below the basic cost of living. So we remember that 9% of households in Hawaii are below the federal poverty level, while a further 33% of households live below the basic cost of living. So these are households that, because of the jobs that they're working, because they are employed, they are unable to afford basic necessities of housing, food, childcare, healthcare, and transportation. Because they're very income constrained. So they're doing okay, but if something happened, there was enough to throw something off, like a major car payment or a health payment or something like that, then they could very quickly move into being below the federal poverty level. And if I want to learn more about ALICE and this indicator, I can come here and click on United for ALICE, which brings me to the national website. I can also scroll down in this report, and again, this information is available all the way down to the zip code level. So if you're really trying to look in your zip code and you want to look at what percentage are unemployed or under the federal poverty level plus ALICE, it's a bigger, more robust sort of population that's also very much at need. You can scroll down to here, and again, we can do all of our sorting and whatnot here. You can see that we have the 2020 ALICE report for Hawaii here. It's also within the HHM. So you can view and download the report and learn more about what that looks like here in Hawaii. So it's just another really neat indicator or resource that people may not be aware of that's available through Hawai'i Health Matters. I see that there are no questions in the chat box, so I'm going to just go on. The last thing I just want to show you today, it will be our socioeconomic status tracker. So again, we come to our track progress. You've seen some of the other trackers before. We'll be looking at SES today. And you can see here that this is a view of indicators that all encompass different aspects of socioeconomic status. So from income and income inequality. So this is going to be the Gini index, if you're familiar with that, employment, education, poverty. And so using cash public assistance and SNAP benefits, indicators of neighborhood and housing, so liquor store density, renters, again, who spend 30% more of their income on rent, high housing burden, severe housing burden, so that's how much of your income that you spend on your housing. We look at access to health care, resources for healthy living, and then also populations with special needs in terms of socioeconomic status. There's all here in this one place. And again, each of these have that data in context that you can always hover over to get a little bit more information. So you can see that how we compare what's for Hawaii, how we compare to the US value, what's happening in the trend over time. But I want to draw your attention up here to our geography slider so that you can then control. So this is for the whole state, but let's say I want to look at Maui in particular. Now it will refresh with this whole socioeconomic status for Maui. And then we have all of the other geographies for which there is some information, at least on one or two of these indicators that are available. So some of these can drill down more deeply than others. It depends on its underlying data source. But again, you can see that now, for example, we look at unemployed workers in the civilian workforce. It's 13.8% here in Maui compared to US counties. So we were higher, also higher than the Hawaii value, higher than the US value, and what our trend looks like over time. And again, with all of these, you can click on it and then uncover the underlying data report. So you can then here see, again, how it's defined, why it's important, and you can really see the effect of the pandemic here in Hawaii. And you can go down and you can do some more research and whatever, but that's just to give you just some extra tools that are available. When you are searching in Hawai'i Health Matters, you can always come back to that community dashboard. But if you go ahead and click on a title of an indicator, then you can also search there as well. So then, for example, if I wanted to look at crime information, say if you haven't think about crime, wow, they actually have some crime information. And I can go ahead and click on that and then follow it. So that's another place to search. So I want you to take, and this one, everyone's going to have their own data. So our activity is use the keyword search function to find some social determinants of health indicators in a domain that most interests you. And then once you find those, go ahead and put the name of the indicator in the chat box. And then my other challenge for you is to take the SocioNeeds and Food Insecurity Index values and find out what those are for your zip code. Again, you can enter in keyword searches here in our community health dashboards. So you can just, so if we did doctor, so adults that get into a doctor doing costs and so forth, a whole bunch of things about that. Or if I was interested in disability, you could just go ahead and click on that there and see what we have. This is all the disability indicators. One thing I didn't show you is you can actually say, okay, just show me all of them. I don't know what I'm interested in. You can click show on a dashboard and it will put all of our disability indicators right there on a dashboard. And you can go back and say, all right, well, just show me for the state of Hawaii because you have too much going on here and so on and so forth. So that's your searching function there. So you can then quickly get to see a whole bunch of indicators that we have and how we may be doing. And then my other question is to go ahead and take a look at what your value is for the Socioeconomic Index or the Food Insecurity Index. And so then you would just go ahead and come on in and you'd make sure that you're looking at it by zip code. And then you can go ahead and sort zip codes to make them easier for you to find. I live out in Eva, so I'm 96706. So my index is 13.9% in terms of socioeconomic needs. And if I was going to come back and take a look at my food insecurity out there, again, I'm just going to hit here to sort, and there's 17.5. So that would be just the way to do that. Thank you for attending today. We hope to see you at our June webinar on the 2019 birth record data in Hawaii IBIS. And in July, we'll be featuring the 2019 BRFSS or Behavioral Risk Factor Surveillance System data in Hawaii IBIS.